Hi there, my name is Nicole, and today we're going to be doing a physical assessment video for Santa Ana's School of Nursing. So first thing I'm going to go do is check the medical order and make sure that whatever the doctor has put in for me to do, that I'm doing the right thing. So today is a physical assessment, so let's go ahead and get started. Alrighty, so I'm going to enter the patient room and I'm going to go ahead and perform hand hygiene. Making sure that if I need some certain PPE for the patient, that would have it, if it was like a C. diff patient or a droplet, whatever it is. So PPE, correct PPE. So now I'm going to go ahead and provide patient privacy, and let's go ahead and introduce myself. So, hi there, my name is Nicole. I'm going to be your nurse today. Can you go ahead and please tell me your name and your date of birth?
Yeah, Casey Kackman, April 3rd, 1992.
Sounds great. It was just your birthday a few days ago. Happy belated birthday. So let's go ahead. So Casey, today I'm going to be doing a physical assessment on you. Pretty much just making sure everything is good. Can you go ahead and tell me, do you know where you are?
Yeah, at the hospital.
Okay, and do you know why you're here?
I just had a headache the past few days.
A headache, okay. And do you know what year it is?
Yeah, 2020.
Okay, sounds great. So I'm verbalizing right now that my patient, she knows she's alert and oriented ×4. She knows her time, place, situation, and who she is. And then she also doesn't look any signs of distress. Her skin doesn't look super flushed or anything like that, or super red either. So now I'm going to raise the height of my bed, making sure it's at a comfortable working position, so up to the hips, and then I'm going to go ahead and start. So now we're going to go ahead and just check the head. Any pain at all, Casey? Like any pointed pain at all?
No pointed pain, just overall pain.
Like an overall pain?
Yeah.
Okay, from the scale of 1 to 10, 1 being the lowest and 10 being the highest, what's the level of pain?
Probably like 7.
Like a 7? Okay, so we'll make sure that we get any medication that might help with the pain later on. Alrighty, Casey, so now I'm going to go ahead and just check with a light, just behind the ears a little bit, making sure that there's no cuts or anything like that, or super dry areas. Looks really good. I'm going to just check for your pupil reaction, so go ahead and just, perfect. Okay, perfect. Her pupils look, both are reactive, they're both equal, and they're reactive to light. Okay, so I'm going to just check. So her eyes, the sclera of her eyes look nice and white, so there's no sign of like jaundice, for example. No yellow in the eye, so it looks nice and healthy. I'm going to check for the nose. Okay, good. Open your mouth real quick. Good. She doesn't look like, her mouth doesn't look super dry. If it was, I would probably make sure that she's well hydrated after. And yeah, okay, so let's go ahead. I'm going to go ahead and raise the bed to 30 to 45 degree angle, just to check jugular vein distension. So right here, if it was super prominent, it would probably indicate maybe some hypotension, some, it would mean maybe she has some sort of issue with overhydration or something like that. And if it was super sunken in, it would mean maybe she is dehydrated, or yeah. So we're gonna go ahead and check. Yep, looks good. Okay, so we're gonna go ahead and check just the tugger of her skin. It looks like it's bouncing back nicely, so looks like she's well hydrated. So Casey, right now we're gonna do your lung sounds. So just go ahead and breathe at your pace, and then I'll just let you know when we're done, okay?
Okay.
So just go ahead and start breathing for me. Okay. Okay, and I'm just going to check down here. Okay. Alrighty. Her lung sound strong, and doesn't seem, I don't hear any like stuff in her lungs, like rails or rhonchi or anything like that. So Casey, I'm going to go ahead and check your heart sounds as well, okay?
Okay.
So this is our aortic heart sound. Then I'm going to do her pulmonic heart sound. Okay, tricuspid. Okay, and her mitral. Okay, perfect. If this was a real hospital setting, I would go ahead and obviously put the stethoscope on the actual skin. Alrighty, Casey, everything sounds great. Her S1 and S2 are present. They sound regular. It doesn't sound like it's super bounding or anything like that. So Casey, I'm gonna go ahead and now check your arms. Any pain at all in your arms, Casey?
No.
It doesn't seem like there's any pressure ulcers on her bony prominences here. To touch, her skin feels nice and it doesn't feel like it's super hot. Doesn't feel like clammy or anything like that. It doesn't feel super dry, but it doesn't feel clammy. So I'm gonna go ahead and check her radial pulses. Not with my thumb. Alrighty, perfect. They feel nice and equal. I would say +2. Casey, can you go ahead and pull for me? Perfect. Now go ahead and push. Sounds great. And I'm going to go ahead and just check for cap refill. Okay, it is under 3 seconds, so we're good. Just checking skin tugger here. It's not tenting. If it were, again, it would be a sign of dehydration. Now I'm going to go ahead and check for, I'm just going to go ahead and look at the stomach and just first visually see if there's any distension at all or any like super like contoured area. Looks good. So now I'm going to go ahead and just palpate. So any pain at all, Casey?
No.
Anywhere here?
Mm-mm.
Okay. How about there?
No.
Sounds great. So now I'm going to go ahead and just here for bowel movements. Okay. Perfect. Perfect. Everything sounds great. Casey, when was the last bowel movement that you had?
Last night?
Okay. And then was it normal for you?
Yep.
Nothing irregular? Okay, perfect. And then any, when was the last time you urinated?
This morning?
Okay, perfect. And normal, everything was good? Okay, and your last menstrual cycle?
2 weeks ago?
Okay, perfect. Everything normal there?
Yep.
Awesome. So from there, I would go ahead and check her peri area, make sure everything's good. If she had a Foley catheter, I would look at what, how much, the volume of what, was outputted. I would look at the color, if there was a certain smell or anything like that. So I would just make sure I'm looking at her Foley. From there, I'm going to go ahead and uncover her legs real quick. So I'm going to go ahead and just check her legs. Any pain at all, Casey?
No.
Perfect. Okay. Any pain there at all?
No.
Sounds great. So Casey, now I'm going to go ahead and ask you, can you go push down? And then push upwards. Can you wiggle your toes? Can you move them side to side, your whole legs? Perfect. And can you raise your legs? Perfect. So she has, I would say, a +5 for both her upper extremities and her lower extremities. I'm going to go ahead and check for her dorsal pedialis pulse. Okay, perfect. So I can feel those. This is her posterior tibialis pulse. And then she has her popliteal, her femoral are right here. She has her brachial, and then she has her radial, her carotid, and her temporal. So I would just make sure if I couldn't feel the ones here, I would just go up in order from toes to head. Alrighty, Casey, so now I'm going to go ahead and ask you, are you able to get up by yourself and sit up? Perfect. So let's go ahead and I'm going to go ahead and listen to the your lung sounds from your back. So just start breathing and then I'll let you know when we're done, okay? So go ahead. Perfect. All right, perfect. So I'm going to listen to, so on the front I listen to 6 lung sounds, and on the back I listen to 8. So now I'm going to go ahead and just look for any, I'm going to look, the alignment of her spine looks good. Any bony prominences, I would just check for pressure ulcers, skin integrity overall. Her skin looks good. Nothing seems to be like any pressure or ulcers or DTIs or anything like that. Casey, can you go ahead and just lay on the side real quick, on your side? Perfect. So I would go ahead and check the patient's back of like her buttock area, make sure there's no pressure ulcers on like the coccyx or anything like that. Make sure its skin integrity is good there. Make sure that the back of the leg is good. Any pain at all?
No.
Okay. Her heels look good. Doesn't look like it's any concern for pressure ulcers. If there was, I would make sure that I would elevate her, you know, whatever it is that seems to have pressure ulcers, or put a pad under it or something like that. Alrighty, Casey, everything looks good. Skin integrity looks good. It doesn't seem like she has any pitting edema. Bounces right back. Looks good. Alrighty, Casey, so can you go, are you comfortable? Let's go ahead and get you in a comfortable position real quick. Okie dokie. So make sure that she's good. I'm also going to check for if she has like IVs or anything like that in her arms, or any other tubing, like a chest tube, just to make sure everything looks good, draining good. I would look to see if the IV area is patent, and if it wasn't, then I would obviously have to fix that. Anything else I can get you, Casey? No? Okay, so here's your call light. If anything comes up, or if you need anything at all, just go ahead and you can press that button. I'm going to now lower the bed just to make sure that she is in a safe position. So I'm going to lower it, and then I'm going to put just the side rails up. I can do 3, not 4 though. And then from there, I'm going to, anything else, Casey, at all?
No, that's okay.
Sounds great. So now I'm going to perform hand hygiene, and from there I'm going to document my findings to, and just, yeah, document my findings. Perfect. Thank
you. Okay. Hi, Isabella. I'm Kelly. I will be your nurse today. I will be performing your new patient physical assessment. If you have any questions, or if you're uncomfortable at any point, just let me know. Going to wash my hands and then put on some gloves. When I'm doing this, can you just confirm your name and date of birth for me? Isabella Brown, 9/11/91. And then can you tell me where we are right now?
Marquette Hospital,
And then what year is it?
2023.
Awesome, great. I'm going to, sorry, the gloves are stuck on my hands. I'm going to start by inspecting your skin of your upper and lower extremities. I'm just going to feel for warmth and moisture is dry, and your skin trigger is elastic. I don't see any lumps, bumps, abrasions, or lacerations. Now I'm going to inspect your head, just looking for your hair distribution, any lumps, bumps, abrasions, or bruises. I'm just going to lightly palpate. Is there any pain when I do that? Nope. Can you open your mouth for me and then close? Did that hurt? Nope. Great. Now I'm going to test your sense, or do a couple, sorry, I have my basket of things that I need. A couple nerve tests. So can you smile with your teeth for me? And now frown, wrinkle your forehead, and then puff out your cheeks to let me squeeze. Awesome. Now I am going to, can you close your eyes super tight? Don't let me open. Awesome. Now I'm going to feel, do sensations of your face. So this is dull and this is sharp. I'm going to ask you to close your eyes, and then I'm going to place it on somewhere on your face and just tell me like what you feel and where you feel it. Okay, ready? Mm-hmm.
Dull right cheek, sharp forehead, sharp left cheek.
Great. Now I'm going to inspect your eyes. So I'm going to start by just looking at your hair distribution of your eyebrows, your eyelashes, your sclera, your iris, and then your conjunctiva. Everything looks good. Now I'm going to ask you to close one eye, and I'm going to do your visual acuity. So how many fingers am I holding up? 2. Great. Switch. How many? 3. Great. Now I'm just going to check your extraocular movements. You could just follow this with your eyes only, don't move your head. Now I'm going to check your pupillary response, so just look straight ahead at my finger. Great. Now I'm going to check your eyes with the with this. So just look straight ahead at the bright light that I will be. Awesome. Great. Okay, everything looks good there. Now I am going to inspect your nose. I'm just looking at the outside of your nares and the inside, and I'm going to palpate your sinuses. Is there any pain with that? See, that was your frontal. Now your maxillary sinuses. Any pain with that? Great. Now I'm just going to inspect the inside of your nose. I have a disposable head, so don't worry. Tilt your head back. Just inspect the inside. All right, great. Now the other side. Oh, sorry. All right, great. Throw that out. Now I'm just gonna inspect your mouth. Can you open up wide for me? Stick out your tongue and say ah. Can you move your tongue side to side? Okay, great. That's that. Now I'm gonna look at your ears. I'm just looking on the outside, looking for any redness, swelling, drainage, cuts or bruises. Is that painful when I palpate? Nope. No? Okay, great. Now I'm gonna take a look on the inside of your ears. I have a new disposable cap. So I'm just going to place this side of your head. And we're in. Great. Now we're going to move on to the other. All right. Everything looks good there. All right. Now I'm going to move on to your neck exam. I'm just looking for any enlargements, goiter. I'm going to lightly palpate. Any pain or tenderness with that. Okay, great. Now, I'm gonna go back to your ears. I have a couple more tests I have to do. I'm gonna stand behind you and whisper a word in your ear, and I would just like you to repeat it for me. Okay? Summer.
Time.
Great. Now I'm going to do a couple tests, again with your ears. So I'm gonna bang this on my hand and then place it on your forehead. And I'll ask if you just tell me if you hear it in both ears bilaterally.
I hear it in both.
Good. Okay. Now I'm going to do it again, but on one ear, and I'll ask you to tell me when the sound stops.
Stop. Stop.
All right. Now this side.
Stop. Stop.
Great. Okay. Sorry about that. Now I'm going to move back to your neck. Just looking for any lumps or bumps. I'm palpating. Any pain with that? Nope. Okay, now I'm going to palpate your lymph nodes, starting with your preauricular, postauricular, occipital, tonsillar, anterior cervical, posterior cervical, submandibular, submental. And can you lift up your shoulders like this? Supraclavicular, and then don't let me push down. Great. Now a couple range of motion exercises. Can you look to your left and then to your right? Now up, down, and can you bring your ears to your shoulder? Now the other side. Any stiffness or anything with that? Nope. Okay, great. I don't see any cups of water. Okay. Up. I'm going to now just inspect your thyroid. I don't see any lumps or bumps. Palpate it. Okay, I'm going to ask you to take a sip of water, but don't swallow it until I say swallow. I'm going to stand behind you. Swallow. Okay, great. Thank you. Now I'm going to move on to inspecting your posterior chest. So I ask you, just turn it around for me. I'm just inspecting for symmetry. I'm looking at your spine. I'm going to palpate your spine now. Any pain with that? Nope. Now I'm going to percuss. Any issues or pain with that? Nope. Okay, great. Now I'm going to just assess for some costovertebral angle tenderness. So I'm going to just pound on your back. Let me know if it's tender or painful. Nope. And then again? No. Okay, great. Now I'm going to just, every time you feel my hand on your back, say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Great. Now I'm going to take a listen to your lungs. So every time you feel my stethoscope, just take a deep breath in for me. All right, great. Now I can have you turn back around. Now I'm going to just assess your anterior chest. Again, just looking for any symmetries or abrasions or anything. I'm going to palpate now. Any pain with that? Nope. Okay, I'm going to percuss the same spots. All right. Next, I am going to do the same thing. Every time you feel my hand, just say the words 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
There you go. Now I'm going to listen to your lung sounds again. So again, every time you feel my stethoscope, just take a deep breath in. Great. Now I'm going to take a listen to your heart sounds. You can breathe normally. Starting with your aortic, pulmonic, point, tricuspid, and mitral. Great, I'm going to take a listen with just the other side of my stethoscope, starting with aortic, pulmonic, point, tricuspid, and mitral. Great. Now, I'm just going to listen or palpate for your carotid arteries. Again, just looking for any jugular vein distension. Great. I'm just going to take a listen with them with the bell of my stethoscope. Oh, sorry. I'm going to do that again, but have you hold your breath. Sorry, I forgot to say that. All right, breathe normal. One more time. Great. All right. I am going to have you lay back for me. Thank you. I'm just going to now, again, just inspecting your anterior chest, making sure that you're breathing equally. And there's no barrel chest. I'm going to now just lightly palpate your chest. And I'm palpating for the point of maximum intensity. Oh, sorry, maximum impulse. Okay, great. I'm just going to percuss the same spots. Now I am going to ask you lay on your left side. I'm just gonna listen for your mitral valve with my diaphragm. And out the valve. All right, great. You can go ahead and lay back normally. Now I'm going to just inspect your abdomen, move on to the abdominal assessment. I'm looking for any distension. I'm looking at the contour. No distension. Excuse me. Now I'm going to listen to your bowel sounds in all 4 quadrants. All right, now I'm going to listen to your arteries with the bell of my stethoscope. Starting with aortic, renal, iliac, and then femoral. All right. Next, I'm just going to percuss for your liver borders. Great. Now I'm just going to lightly palpate your abdominal area. Let me know if there's any pain or tenderness with that. Any pain? No. Okay, now I'm going to just do a deep palpation of those same spots. Any pain with that? Nope. Okay, now I'm going to just palpate for your liver and spleen to look for any enlargements of those organs. So I ask that you just breathe in. Great. Now for the spleen. Great. Now I'm just going to feel for your inguinal lobes and femoral pulses. Great. Okay, I'm going to ask you to sit back up now. Oh, sorry. Sorry. Ask that you lay back down. I'm going to do some passive range of motions of your legs. Go ahead and kick your leg up and out, back in, out, up, down, and out. Great. Switch. Take your leg out. Okay, great. Can you roll your ankles for me? Awesome. All right, now you can go ahead and sit back up. Sorry about that. Now a couple more range of motion exercises. I'm going to ask you to move your head towards my hand. Great. Now again. Awesome. Lift your hand up and out. Move don't let me push your arms down. Don't let me push up. Great. Now I'm going to ask you to put your hands like this. Don't let me pull. Don't let me push. Great. Now can you put your hands out like this? Wiggle your fingers. Cool. Try not to squeeze you in. Great. Now can you squeeze my fingers as tight as you can? Great. Now I'm going to ask you to just put your hands like this. Change. Yep, great. Awesome. Thank you. Now I'm going to just do some for your legs as well. Keep your legs as close to the table as you can. Don't let me push. Don't let me pull. Now can you bring your legs back out? Don't let me push down. Don't let me push up. Great. Now I'm going to ask you to press down like a gas pedal and then bring your toes to your nose. Great. Now a couple of sensations. So I'm going to ask you in a minute to close your eyes, but first, this is up and this is down. I'm going to ask you to close your eyes and tell me what I'm doing to your toes. Okay, close your eyes.
Up on my right toes, down on my left toes.
Great. Now I am going to do some other cerebellar function tests. I'm going to ask you in a minute to close your eyes and then rapidly move your fingers like that. If you could go ahead and do that for me. Great. Now can you put your arms on your thighs and then quickly move your wrists back and forth like this. Awesome. Now I'm going to ask you to put your right heel on your left knee and bring it all the way down to your ankle. Great. Now can you do it on the other side? Awesome. Now I'm going to do a couple reflex tests on your arms and legs. As for this, just bring your arm out like this, and I'm going to test your tricep reflex. Great. Now this one. Do that again. Sorry, I missed. There you go. Thank you. Now just keep your arm relaxed like this. Your bicep reflex. Good. I saw the touch. Great. Now for your legs, your patellar. Just gonna lightly tap here. Great. Now for your Achilles reflex, just behind your ankle. Great. Now a couple more sensations. Again, I'm going to do your extremities like I did on your face before. This is dull and this is sharp. I'm going to ask you to close your eyes and then I'm going to do those on your arms and legs. Just tell me what you feel and where you feel it. Okay? Ready? Go ahead. Close your eyes.
Dull right arm, sharp left arm, sharp left leg, dull right leg.
Great. Now I am just going to do a couple more sensation feelings. So I'm going to tap this on my hand again, and then I'm going to place it on your wrists or ankles and just tell me when the sensation stops, okay? Stops. Great. And do it again. Stops. Stops. And stops. Great. Now I'm just going to check your capillary refills on your hands. You can see your thumbs. Great. And your toes. Great. And now I'm just looking for any peripheral edema on your legs. Any pain, numbness, or tingling with that? Nope. Great. Now I'm going to check your pulses. Can I see your radial pulses? Your popliteal pulses. Your pedal pulses. And then your posterior tibia pulses. All right. Awesome. I think now I'm going to have you stand up and we're going to do some gait testing. So I ask if you can just 3 steps heel to toe for me. Great. Now can you walk on your tippy toes? Awesome. Can you turn around and walk on your heels? Great. Now I'm going to ask you to keep your feet as tight as you can with your arms out and close your eyes. Great. Now I'm going to ask you to turn around for me. I'm just going to inspect your spine. Looking for any abnormal curvatures. Great. I'm going to ask you to bend down. Looking for any abnormal curvatures again. All right. I think it looks great. You can go ahead and sit back down. Okay.
The camera couldn't see you take my lower extremity pulses. I don't know.
It's okay. And that concludes our assessment.